Hi everyone, my name is Claire Carmichael. I'm a registered nurse and today's vlog is all about transgender health. Firstly, why am I so passionate about transgender healthcare? This is something I am very passionate about, which you will probably see throughout this vlog. But I first fell in love with transgender healthcare as a GP nurse. So I started off, anybody that knows me, and I started off as a GP nurse in January 2020. And it was there when I had my first transgender patient for the hormones. And I suddenly realised that I'd never had any transgender patients. I've never given hormone injections to transgender patients. I've never had any training, education, nothing on this. So I dug a little bit deeper and I went to my GP partner at the time, the GP manager as well, and asked for specific training on transgender healthcare, specifically the hormones I'm giving, what it does to the body, endocrine sort of things, because it works on the endocrine system. And I was just referred to an LGBT webinar. Very basic, it wasn't what I needed, it's not what I really wanted, and it looks like that there is no training for NHS staff. There's nothing out there at universities on transgender patients at all. So what did I do? I took it upon myself, and I advise everybody to do this as well. Do your research, do your own research. So I spent the next 2 years researching every guideline policy, looked into science behind things, looked into research papers, that sort of thing, evidence that was out there, looked up a whole load of different government bodies and things like that to see if they had anything, and found actually there is a lot of information out there that people either just don't use because they don't want to use it, or they just don't know it's there. I also took to social media to talk to trans patients themselves, not my patients, but trans people in general. So I went onto different social media platforms. I set up meetings with people to talk to them to see what their lived experiences are of the healthcare systems. And I looked up at the government statistics as well on hate crimes and things like that. And there's a lot out there that's saying there's one, discrimination in healthcare against transgender people, and two, there's not enough training and education. So a lot of doctors and nurses don't have that information and competency and confidence to treat a transgender patient and give them hormones because they've never had training and education. And it's actually really heartbreaking to look at the statistics and look into the discrimination in trans patients in healthcare. And this just shouldn't be happening anywhere. And the more research I did, the more discrimination and inequalities I found within our healthcare system, which just shouldn't be happening. So on the back of all of this, I started to set up with my partner, George. George, if you don't know, my fiance, George is a proud trans man. And together we set up some webinars to deliver to students, primary care trusts, doctors, nurses, anybody that will listen. We started those in January 2022 this year, just to help educate people and get more information out there to help people give best care possible to trans patients. And I'm really passionate about this. George is really passionate about it because we want to make a change in whatever way we can. And this is why I'm here today doing this vlog, to hopefully give you some tips, advice and help to help you care for your patients. So I briefly mentioned that there are a lot of guidelines out there, so I want to put these here for you now. This is the first one, the WPATH guidelines, or the WPATH I like to call it. They are the World Professional Association of Transgender Healthcare. I think of them as the gods. It's like the WHO of healthcare. If you think about the WHO, the World Health Organization, these people are dedicated people, qualified professionals who have gone out there, they've done the research, they've got the evidence, they've done everything to set up standards of care for transgender patients. It's there, it's set in stone. These are the guidelines that the NHS themselves use for the NHS GIC clinics, gender identity clinics, and the GIDS, the gender identity development services for youths, adolescents. And these standards of care, there is a version 7 and there is a version 8. The version 8 update is the new version of the WPATH standards of care. And that just gives little bits of updates and changes that they've made to their previous version, but version 7 is amazing as well. It gives you all of the guidelines, guidance, and treatment protocols and the things that you should be doing to treat transgender patients. The next guideline we have here is our Endocrine Society. That's right, even our Endocrine Society, we know they're all legitimate, registered professionals. They're qualified in the endocrine system. These are the top dogs. If you're going to go to anyone, you need an endocrinologist on your side. They've created guidelines on the hormones, what we should be prescribing patients, what levels we should be checking, what the blood levels should be, what the ranges should be. They've got everything you need to treat and follow up and monitor your patient. They have got everything there for adults and adolescents and how to prescribe. Next up, we have our NHS GIC. Our NHS has got a guideline. They've got many guidelines, but people aren't seeing it. People don't know it's there. I don't know what's going on with these guidelines, but nobody knows about them. But when I researched, I found them all. I mean, I'm not going to lie, it took me days of researching and trying to find guidelines. But once I found them, I found the gold standard. And anyone that's got these guidelines would be able to treat a transgender patient. And I know as nurses, we're not prescribers, so we wouldn't be doing this, but I'm hoping that giving you these guidelines, you can pass them on to a doctor, nurse prescriber, and show that the guidelines are there for them to treat their patients. And the whole NHS GIC website itself has guidelines for everything. It's got emails as well for healthcare professionals. So if you're struggling with your patient, you don't know what to prescribe, you don't know what you should be doing with them, they've got a dedicated email and phone number for healthcare professionals to ring and ask what they should be doing. Next up, we have our very own CQC Care Quality Commissions. They have even produced a transgender pathway for people to look at and follow. The guidelines are there, the research is there, but yet GPs, doctors, nurse prescribers, nurses just aren't seeing it. They aren't looking at it. They're not following the guidelines. They're not doing their research. They're just fobbing patients up saying, I can't treat you because I don't know anything about you. It's not good enough. The guidelines are there. Do the research. Anyway, not going to vent because this is what usually happens when I talk about this. I start venting about people. Anyway, CQC have a pathway. Now, if you are a transgender patient going to your GP, you do not need any legal documentation to change your name on the system. CQC says so. I'm going by the CQC and I'm going by what's right for my patient. It's no different to if you had a patient saying, I want to change my name on the system. I don't want to be called John. I like to be called Jack. So you would put preferred name Jack. We do it for cisgender patients. It's the first thing I learned as a student nurse, first year, first module, professional values, communication, all that jazz. First thing we were taught, and I'm assuming everyone else has been taught this, we should be introducing ourselves to our patients. We should then be asking, what is your preferred name to our patients? We do it for every patient, regardless of what gender they are, sexuality, race, or disability, anything like that. We should be asking that to our patients from the get-go, and we should be documenting that. The Royal College of Psychiatrists, again, registered legitimate healthcare professionals, have produced guidelines for transgender healthcare and how we should be treating trans patients. It's all there. Have a look at the guidelines because it's amazing what you find when you start searching these things. And lastly, I'm going to end this resources guidelines bit with the Equality Act. I'm going to remind everybody, if you don't take anything away from this video, remember your Equality Act. It does include transgender patients and people. It's a protected characteristic. You should not be discriminating against any transgender person. I get it, we all have our own opinions about everything in the world. You might not agree with something, but the minute that leaves your mouth in front of people that's going to harm somebody, it becomes a hate crime. And I get people, freedom of speech and all this, people always bang on about it. I saw it the other day on something like This Morning or something like that. Other TV shows are available, but there was this debate about freedom of speech, and I was just like, Yeah, you can have freedom of speech, but the minute you're hurting somebody, the minute you cause offence to somebody, that's when it turns hate crime. It's when it turns into bullying. You can't just say, oh, it's my freedom of speech to call you this and harm you in this way. That's not okay. We've all got healthy debates that we can have on social media. We've all got healthy conversations that we can have in a professional manner, but we should not be using our freedom of speech to put other people down and hate on people for who they are. That's not okay. Anyway, enough of that. The do's and don'ts. So my best tips and advice as best as I've got to help you when you are with transgender, non-binary people. First up, the do's. So it's common sense, but treat everyone equally. Treat everybody as in a non-judgmental way. Please, please, please preserve their dignity and respect them. Please, please, please use people's pronouns. Just be respectful. And another thing on pronouns as well, a lot of people think pronouns are about you, and it's not about you. It's about the people in front of you feeling safe. I know I've seen it on social media quite a lot. People just going off on one about pronouns, saying, I'm not going to use that on my email. I'm not going to put it on my social, she, her, because everyone should just know that I'm a female. But actually what that person is saying is society has taught us what a female should look like, so everyone should just assume that you're female based on how you look, which isn't actually right. You know, society it's learnt behaviour. Society in TV film, in TV shows, in films, in documentaries, that sort of thing, it's always portrayed transgender people as the villain, as this comedy act, as this thing that we should laugh at, as mainly it's normally, from what I've seen, not from shows, is a man dressed up in a dress, and it's all this comedy, like ha ha thing, like we should be mocking transgender people, and this is learned behaviour. The world around us for years and years and years has taught us that it's not okay to be transgender, when actually it is. Not only that, the world has also taught us that to be female, you should have long hair, you should have makeup, you should look this way, you'd have the colour pink, you should like glittery things, and women should be cooking in the kitchen, and all these really outdated terms. And then for the men, it should be things like men should be tall, men should be strong, men shouldn't cry, they shouldn't show emotion, they should play with cars, they should be rugged, they should have short hair. Who said so? Who said what a man and a woman should look like? Who created that rule? Anyway, back in the room, pronouns, the thing is, the best thing that you can do with pronouns is when you first meet a patient, is sit down, say, my name is Claire, my pronouns are she, her. Obviously say your own name and pronouns, not mine, because that's weird. What are your pronouns? Just do it for every patient, and then it just creates this normalized standard across the board. But what this does, and what this says, which is the main point, is if you've got somebody who is part of the LGBTQIA community, you might not know that they're part of that community. You don't know what that person should look like, or whatever perception people have in their mind of what an LGBTQIA person should look like. You don't know who's going to be sat in front of you. So you need to be really mindful of that, and what you're doing by saying what is your pronouns. This person is connecting, because pronouns is well used in the LGBTQIA community, and you saying that to somebody is saying, wow, this person knows about pronouns, this person is a safe person to talk to about LGBTQIA issues, and I can be myself around them. That is what that message is given. It's not about you and your gender or sexuality. It's about the person in front of you and making them feel comfortable and safe. Next, if you make a mistake, just apologise and move on. Don't make a big song and dance out of it. You know, we all make mistakes and people understand that, but it's when we're continuously going he, when actually this is a trans woman in front of you going by she and her, and you're constantly like, oh, he. Just no. Listen to the person in front of you. This is the biggest thing, because everybody is different. Everyone in the world is unique, amazing, wonderful people, And no two people are the same. This is the same for transgender and non-binary people. They will be on different journeys. They will want different outcomes from their transition, for example. They'll be going through completely different things. So it's really important that you sit down with the person, listen to the person. That is the biggest tip I can ever give you. Listen to who's in front of you, because they are the experts on their health. And lastly, for do's, like I said, do the research. If you don't know something, look at the guidelines, look at the research, talk to the person in front of you, and you'll be well away. Now for the don'ts section. So do not ask somebody what genitals they have. Don't talk about invasive procedures that they might have had, surgical procedures, inquisitive, like that sort of thing. It's none of your business unless you are a sexual health nurse that needs to check somebody's genitals or body. It's nothing to do with you. It's none of your business, and it's going to make someone feel really, really uncomfortable. Please don't ask somebody what they looked like before their transition. Again, irrelevant, really offensive, and it'll bring up some really painful trauma for that patient. Never, 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 I have to say, this is one of the biggest things that you could ever do that you should never do. Mention somebody's dead name. Do not call someone by their dead name. This is not okay. The emotional impact and mental impact and the trauma that brings up for someone is horrific. And I have two stories here to show you the good side of calling someone by their name and the bad side when you call someone by their dead name. So the first story I have is an amazing patient that I had. They were very, very young, 15 years old. They were transgender. It was a transgender boy, and they come in with their mum. And on the system before they come in, I could see the name hadn't changed or anything, but I could see preferred name was different to the birth name. So I kind of clicked then that this person's probably transgender young boy. So I listened to that, and I picked up the tannoy to call the patient. We're going to name him David for confidentiality reasons. This is not his real name. And I picked up the tannoy and said, David, could you please come to room 1? And when that patient and his mom come into my room, they were beaming. They were so happy, and just seeing how happy it made them for me to call them their real name and not their birth name or their dead name was incredible. And the mom, especially the mom more than the boy, the mom was ecstatic, the mom was beaming, and she actually said to me, thank you so much for using his real name, because so many people keep calling him his dead name and it really does affect him. And just seeing that one thing that I did, just using the right name for somebody, and the difference that made, that impact was, it hit me hard. Like, it really made me feel up to see that. It makes me feel up when I think back to that. And that is a memory that I've always got logged in my brain, because when you're speaking to patients, just knowing that small thing, that really tiny thing, it doesn't take much to call someone by their name. But it can make a real big difference. So now the not so good story. So my partner George is a proud trans man, and he unfortunately had somebody dead name him recently. It was a couple of months ago. He was on the phone to a company who had been misgendering and getting his name wrong for a number of reasons. I don't know why, because it is on the system. He did submit everything to change his name and everything with them, and apparently they didn't listen to it, and unfortunately his birth name and things like that were still on the systems. So they were dead naming him, and I was in the next room and I was listening to the conversation when he was on the phone to them, and it was hard as a partner to witness that and to see how much that really affected him. It really affected him mentally, just hearing that birth name, because that's a reminder of who he's not. That's a reminder of somebody that's dead to him. So to hear that is a massive effect, and it was hard to watch and listen to as a partner. So please just don't dead name anybody. Don't act shocked when you look at somebody and they say to you, I'm transgender. Don't go, oh my God, you'd never know you were a trans person. And I absolutely wholeheartedly have my hands up for this. I know I've absolutely done this in the past, because at the time I wasn't aware of things. I wasn't aware of the impact that might have on somebody. But what that's saying to somebody is, if you're saying to somebody, oh, you'd never tell you were a transgender person, that's saying that in your head, you have an idea of what a trans person should look like. There's no way a person should ever look in this world, regardless of what gender, sexuality, race, anything like that. So we shouldn't be passing that judgment. And it's like a backhanded compliment to somebody. It's not even a compliment, it's a backhanded comment, sorry, to somebody. And I hold my hands up. I thought that it was like a compliment, like, wow, you never tell you're trans. And this is because of society. Like I said, TV shows, documentaries, all of this learned behaviour thrown at us from the beginning of time has said this is what a trans person should look like. You should be able to tell that somebody's trans. You would never tell. I bet you've all met a transgender patient without even realising it, in the street, in the shop, walking past somebody. You would never know because there is no right way to look. It's the same with, I have transgender friends, my partner George, he's transgender. If anyone passed George in the street, you would never know he was a trans man, not a clue, because in society, he passes for a cisgender male. What that should ever look like to society. So if you can, please avoid using those sort of words of you would never tell. Just say, okay, that's great. Is there anything I can do to support you? That would probably be better than saying those sort of reactions or looking shocked from it. And lastly, for the don'ts, please, regardless, like we've said, of your opinions, do not tell a trans person, do not put it out there public that a trans woman is not a woman and a trans man is not a man. Regardless of your opinions, regardless of whatever scientific facts and biology you're going to bring into it, do not say that to somebody. It is hateful, it's harassment, it's not nice, and the amount of trauma you will cause from that one comment could literally end somebody's life. And I think that's the thing that people don't realise. Suicide rates are much higher in transgender community over the general population, probably because of the amount of hate crimes that are happening, the amount of discrimination, inequalities that they have to face every single day, from their family, from their friends, from strangers in the street, from themselves. They hate themselves looking at themselves in the mirror because they don't see who they really are in the mirror. It doesn't reflect that. So imagine having all of that and then coming to you as a healthcare professional, one of the most trusted professions in the world, and you're going to misgender them. You're going to start telling them they're not a real woman, they're not a real man. You're going to start not using their pronouns. You're going to get things wrong. All of those years of hate crimes, discrimination, feeling like utter rubbish, and then that final comment might be the nail on their coffin. Do not be the statistics. Do not commit hate crimes. Please, please, please do not be that final nail on the coffin. Get it right. Try and get it right out there, please. And you know what? Just by acting kind to somebody, using people's names, not misgendering somebody, getting it right could literally save a life. So on that happy note, I am going to end this video on that note, but I hope that you've taken something away from this video. Look at the guidelines and research that I've shown and just have a little research into things yourself and speak to people and speak to the patients as you get them. It can really, really make a massive difference. We're here as nurses to treat patients. We should be treating everyone equally, and we should just spread more love, spread more kindness out there and save lives.